Hi everybody. Today I want to talk about how doctors actually diagnose vestibular migraine and share with you a list of common features physicians use. Hi everyone, welcome to my channel devoted to all things vestibular migraine. My name is Dr. Mushtagi with otolaryngology, head and neck surgery. And today I want to talk to you about how to diagnose vestibular migraine. To start off, people have been noticing this association with migraine and vertigo for centuries. Throughout the decades, we struggled as physicians to not only notice it, but label it and study its symptoms. This field is still in its infancy compared to other conditions of the ear and the brain, and is constantly changing with evidence-based research. Because of this relatively newer diagnosis, correctly diagnosing a patient can be difficult to achieve. The challenge with vestibular migraine is twofold. The route patients take to the diagnosis can vary depending on the type of physician they see. Both a neurologist and a head and neck surgeon in ENT, which is my specialty, see these patients. As a function of physician experience, training, and background, the diagnostic journey and treatment strategy to vestibular migraine can be different. Second, the symptoms of vestibular migraine can be so diverse and unfortunately overlap with other conditions, which make it really difficult to pinpoint the true diagnosis that needs the proper treatment. It's important to know that there is no special blood test that can be used for the diagnosis clinically at this time. Diagnosis is often made with a history and physical examination alone. These findings often assist in ruling out different diseases such as benign paroxysmal positional vertigo, BPPV, or Meniere's disease. But to complicate the picture, there are also other studies showing a clear overlap between these conditions and also migraine, but that's a different topic. There are also complex vestibular diagnostic tests, things such as VNG. This can measure your balance function, and these tests can sometimes determine if one side of your vestibular system is weak. However, it's challenging to draw definitive conclusions from these studies. And also the studies also show that there's different testing modalities are not sensitive enough in detecting vestibular migraine and often can be unreliable. But sometimes they can be helpful in ruling out other dizziness conditions as well. Thus, again, as I was saying before, the diagnosis is heavily dependent on obtaining an accurate history of what patients experience in their day-to-day life. If a patient is able to recall the attacks, its details, they are at a better advantage of determining if vestibular migraine is a culprit behind their misery. It's important to understand that not all physicians out there diagnose and treat this condition the same. From a patient's perspective, this can be a point of frustration, as you may be referred from one doctor to another with no help in between. You may be prescribed a list of medications that can often be sedating and find no relief, with only increasing side effect. Or you could just be left feeling hopeless and stuck wishing for a moment to return of normalcy. I put together a guide on navigating and understanding vestibular migraine. Click on the link below in the description to access it. Take care and be well.